This week, we had two stories about black women who were pregnant and turned away at a hospital after being mistreated by hospital staff. Good news, both mothers and their babies are alive and healthy so far. However, that is not the case. ProPublica has published an article detailing the disparities in black maternal health, highlighting stories of black mothers who did not survive. One tragic example, 37-year-old Tiara Walker from Texas, who died 20 weeks pregnant after doctors refused to provide her with an abortion despite severe health risks. ProPublica reporter Kavita Sumrana joins us now to discuss this investigation. Glad to have you on the show, Kavita. What did y'all find out?
Thank you for having me. Well, I think the most important thing to know about this particular story is looking into the fact that abortion bans in the United States don't have real health exceptions for the kinds of risks that women routinely face in pregnancy. And this case really shows that. Tiara Walker, who lived in San Antonio, she was 37, a dental assistant with a 14-year-old son, spent much of her pregnancy in the hospital. She had skyrocketing blood pressure, diabetes, then she developed a seizure disorder and blood clots, and she entered her pregnancy sick, and she got sicker as it went on, as doctors expected. But despite that, and despite asking if an abortion would protect her health, she was never offered that option, her family says, who spent much of the time in the hospital with her, and her records show as well, which we reviewed in depth with more than a dozen maternal health experts across the country. And when you look at how much time she spent in the hospital and see that at least 90 doctors were involved in her care, I really think it points out to how these laws have changed women's health care in Texas and other parts of the country. And because we know that there's a maternal mortality crisis, a maternal death crisis in the United States already before this, and that has fallen hardest on the Black community because of longstanding issues in both, healthcare systems and socioeconomic factors and racial discrimination in the healthcare system, that these laws just worsen that.
And this was exactly what many of us said was going to happen. And part of the problem is that you have doctors who are so concerned because they don't know what the hell to do, threats to take their license. And so many folks say, you know what, we're not going to do anything.
Yes, in this case, we tried to reach out to some of the doctors involved in key parts of her care. We reached out to the hospital and none of them would talk to us. But we have been doing this reporting for years now. We've talked to more than 100 OBGYNs across the country. We've written about specific cases where the doctors did describe how they were confused by the law, that a patient in front of them had a very serious life-threatening condition, but their legal teams weren't allowing them or supporting them to provide care. Sometimes what happens too is you have to remember it's not just one doctor making a decision on a case. These doctors have to work with a whole staff, and especially when a procedure is complicated. So there's a lawsuit going on right now in Texas of a woman who it was written in her records that she needed a life-saving abortion because she had end-stage renal disease, but they couldn't find an anesthesiologist who would participate in the care. So the doctors were ready to, but one doctor who was key wouldn't, or sometimes you hear it's nurses, they can't find a nurse who will help. So, these laws, even when there's misinformation about them, really get in the way of care and even talking about counts, because that's what stands out in this case with Tiara is that no one was even talking to her about it. She was trying, her family who was with her says she was trying to ask and advocate for herself and ask, would it be safer for me to end this pregnancy so I can be here for my son? And they feel that she was dismissed and told over and over, your pregnancy is healthy and we're just going to work on getting your health under control. But her health never got under control. And at 20 weeks, she died of preeclampsia.
Yeah, and again, this woman's dead. And let's be real clear. Texas Republican lawmakers, they don't give a damn.
We always try to reach out to the lawmakers who've written these laws. And actually the legislature had made a small change to the exception in their law this past year. So we reached out to them to ask, that exception or the language was not in effect when Tiara Walker's case happened last year. Do they think it would change the outcome for a patient with similar conditions going into pregnancy, again, with uncontrolled blood pressure, diabetes, and a seizure disorder? Is that what they intended with this law? Because doctors who've spoken to us, they're not sure if their hospitals will support them. And you would think it would be an easy answer to respond to, but we only heard back from one Democratic state senator who just told us that she had pushed for a clearer health exception, but her Republican colleagues, they listen to the far right of their base that really doesn't want to see any exceptions in these laws. I think that's something important to point out, that at every step, not just in Texas, but in other states that have these laws on the books, the anti-abortion activists who have basically written them and supported them, they really fight back against any effort to create a health risk exception. There are exceptions called for the life of the mother, but they're written in ways that are supposed to be for emergencies or extremely narrow. And when anyone tries to say, why isn't there one for just a high-risk pregnancy? That's what so many women in America face. They go into pregnancy with underlying chronic conditions, or they may develop them in pregnancy. They've fought back and they've won.
Questions from the panel. Joy, you first.
Well, first of all, thank you so much for doing this story. What is the family planning to do in terms of a lawsuit, right? Are they going to sue? Because the counterbalance here has to be malpractice suits that are levied against these doctors and the healthcare professionals in the hospital to make them give pause to say, look, not only are there these laws, but our hospital might shut down because of the lawsuits and the legal fees that we might have to pay because of these decisions, so that they will put pressure on their elected officials to create exceptions that protect them and their patients.
That's what we'll be watching. The family wants justice. They want accountability. And they've engaged a lawyer who is looking into filing a lawsuit and what kind of legal remedies there can be. Because one thing people don't think about is that there's often, in Texas, I don't know all the specifics, but the lawyer that they're working with did tell me that there's extremely strong protections for emergency room doctors. It's a very high bar. So sometimes even when something, a wrongdoing has clearly happened, it can be very hard to sue. But they're going to try, and they're also, there's other remedies. I think if the state legislature cared, they could, a legislator could file a complaint with the Texas Medical Board to have them look into this case and get more clarity. So that's something we'll be watching. I do know that there's a number of malpractice cases that are starting to be filed in Texas, and it will raise the question of, have these hospitals been too afraid of their felony charge that is a theoretical charge from the state, and not worried enough about their patients and the malpractice that they could become liable for.
That's right.
Reese?
Thank you for being here. I'm curious, how public is data around issues of maternal or infant mortality in these states that have abortion ban? Is there a way, do you find that it's more prominent in particular hospitals, or is it particular providers? You mentioned that one of the subjects had 90 doctors see her over the course of her hospitalization. So I'm just curious if mothers could potentially protect themselves by accessing data that shows where this problem is more pronounced, or if you found that it's more so statewide as opposed to concentrated in particular areas.
I'm glad you asked that question, because that's one of the reasons we started doing this work at ProPublica, and you can read a lot more of it at our website, propublica.org, because we learned that, yes, while states do have maternal mortality review committees, they're years behind often in their reports, and they often don't report in a kind of granular detail that could be helpful for people in making decisions about their care, like you say. And they're not looking specifically into the impact of these very laws that their state legislatures passed, which are some of the biggest changes to maternal health policy in 50 years. They're not looking into that. In fact, in Texas, they specifically by statute are barred from reviewing any case that involves an abortion procedure. And that can even be for a miscarriage that just used a procedure that they associate with abortion. They're just not going to even look at that case, which is really leaves out an important part of the picture. So that's why we have started to do this kind of painstaking work where we try to go and get the death records, autopsy records. In some states like Texas, that's going county by county to request records, and it's only a sliver of them. It's not the full data. And then we reach out to families and we try to ask if we can look at the case more closely, get hospital records with their help, and then review them with experts. And so even some families just don't want to look into that. So we only are seeing a small slice of these cases. But I think one of the cases that currently has a malpractice case that I referenced earlier, where an anesthesiologist wouldn't participate in her care, this woman ended up getting an advocacy organization called If, When, How to call the hospital on her behalf and threaten legal action. And that's how she ultimately got this life-saving abortion, according to the complaint in her lawsuit. So yes, we do have a guide on our website at propublica.org that's about some of the questions that patients who live in these states can ask their medical providers and what they can try to do to know if a hospital provides or a provider would provide a DNC, for example, or a DNE, and what their policies are. But it puts so much on the patient to have to try to coordinate their own care that is a really unfair outcome of this law. And I think the most chilling thing I've heard from some doctors when I've tried to ask them, what advice would you give a patient if they're pregnant and they're not sure if the hospital will provide them care if they end up having complications in pregnancy, and what can they do? What can they say? They've told me it's very, bluntly that they would tell them to go to a different state, which is just not an answer for a lot of people. Tiara Walker was in the hospital for most of her pregnancy. So the idea of even, beyond financially, but just her medical condition to go and continue her pregnancy in another state or end her pregnancy in another state was really out of reach.
All right, then. Folks, this is the story right here. Ticking time bomb. A pregnant mother kept getting sicker. She died after she couldn't get an abortion in Texas. Kavita, Serena, Lizzie Presser, for the reporters on that. And so we appreciate it. Thank you so very much. Great story, and thanks for the coverage.
Thank you so much for having me. And like I said, we have a lot of resources and more reporting on this important topic and data at ProPublica.
All right. We appreciate it. Thanks a lot.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase, and I'm here with a very important message. We are at a turning point in the Black community where we must have equity in the apps we use that scale to billions of dollars. But this time, we own the infrastructure, we own the culture, and we shape the future. And Fanbase is the future. Fanbase combines the free functionality of Instagram, TikTok, and YouTube into an all-in-one platform built for the evolution of social media and monetization. With over 1.4 million users, that's real proof that we are shifting the conversation of tech ownership and equity for creators. So right now, I want you to go to startengine.com/fanbase and invest today. The minimum to invest is $399. That gets you 60 shares of stock in Fanbase at $665 a share. This marks a turning point in Black ownership of social media. If we don't take this opportunity to own social media right now, we will always be customers to our own creations. And that can't go on. So once again, go to startengine.com/fanbase and invest today. We must own the platforms where our voices live, our stories matter, and where our culture drives the world. Thank you.